This channel will be investigating personal medical stories from veterans within this medical apartheid system who receive medical mismanagement or disrespect from Veterans Affairs and these VA facilities. Now, America does a bad job in taking care of its veterans.
And also our NP at the emergency room had ordered the neck x-ray, the spine x-ray, I should say, in the lower lumbar. And that showed no significant interval change compared to a previous x-ray in 2019. And it's saying here on the report, stable grade 1, anterolisthesis of L5 over L4. Okay. So that's the x-ray, which obviously won't always show the disc disease. X-ray will only show the bones. It won't show the disc. It will imply on the disc, but not what's happening to them. That's the limitation between x-rays and MRI.
Right.
So, we're having, so I'm going to summarize just a bit. You have a generalized spine problem from the neck to the lower lumbar, correct?
Correct.
Okay, so it seems like according to some of the notes from Dr. Wilson, you're having some good and bad days with those. I'm trying to help you, Mr. Henry. You're new to me, as I said.
Right. Well, I'm trying to figure out. Oh, slow. Okay, I'll let you talk. Did I interrupt? You're showing so much physical irritation. It's like, I don't understand how you could be a primary care provider when you're actually showing that. I'd sit here and let you talk, but I'm looking at you and you done did it. That's why I like this point right now, I have to video record this because this is craziness what I'm seeing. You should not be that physically irritated. I am. And when you said that I have some good days and some bad days, it's like you really don't understand what I'm going through. If I have 5 slip discs, ma'am, but barely can stand where I'm bedridden for 80% of my time. First off, so my irritation should be this. I have even more injuries outside of that. I have right ulnar nerve damage where they did. I don't even know if you got that if you only went back to 2017 when they did the surgery in 2014 on my right arm. Do you even got that? Do you got the pinched nerve? Slow.
EMGs that were performed for you.
Right. So, all right. So again, that irritate. See, your attitude is the wrong type of attitude, ma'am. It really is. No. Let's stick here because again, I would like to stick here because if you had this type of attitude, I want to deal with to have this type of irritation because again, I'm questioning you on your knowledge on my medical history. That's your irritation right there. That's arrogance. That's arrogance that don't need to be here. You need to be showing care and concern and compassion as a doctor. Take heed to your Hippocratic oath.
Part of my process as a first visit with the patient is to get to know you as a patient. And whatever may or may not be documented here, I try to start my chart over the way I do my charts. So the questions I ask of you are informative for me, so I get to know you and assist you.
Okay, that's fair.
So when you keep questioning what I know and don't know, you're new to me.
Okay. Can I speak now? Yes, I'm new to you. And you just gave that attitude off again. I don't know. It's like maybe you don't have respect because that's what I'm getting. That's what I'm getting for you right now. Again, I'm speaking. Maybe you don't have respect. Now, I know that you don't know, but if I have over a 10-year history here, should I not be irritated that you only going back to 2017 and that's all you have? And it's like you're starting over. So what I'm looking at again, how can you be a partner in my health and wellness? Slow up. I didn't interrupt you. Do not be rude. Respect commands respect. I let you talk. Let me finish. Now, again, how can you properly help me as my doctor if they're not giving you all the information? It's like, again, that's insaneness to me. If you're trying to help me on my medical, you need to be abreast of all what's going on with me fully. So if I have a 10-year documented medical history here at the VA, there's no excuse that you should only be able to go back 4 years. You follow what I'm saying? So that's like disrespect to the veteran. for over 10 years, you have a built-up history, and you only reading from the past 3 or 4 years. And again, I'm not saying that's your fault and not putting that on you, but again, the only one that should be irritated here is me continuing to keep, again, when I come to you as a doctor, I'm expecting you to already be squared away with information. That's why they digitize it, catalog it, and archive it. But you don't have access to it from what I'm hearing.
I don't have access to all the outside
No,
outside.
inside. I said VA. Stick with me. I said 10-year VA history.
You know what, Mr. Henry, I actually,
Right.
they give me half an hour for a new patient today. So that's what I have. That's what I'm trying to work with. I'm trying to obtain as much information as I can for you in that half hour. Because I do have other patients as well.
Oh.
After you and before you.
Oh. So let's
when you
used to fast tracking, huh?
okay.
No, you totally irritated. I don't even listen. I'm glad to get you because you're the very representation of the doctors that they have there. The very level of arrogance that you have, ma'am. You are out of line. You are out of line and lack real professionalism.
Stop right now.
No, please stop. First, I ain't your child. I'm not your child. You're out of line. That's why I'm recording you. You're out of line.
Here we have your average doctor in the VA. You see the level of disrespect, frustration, intellectual laziness, pure just disdain for even speaking with a black veteran. Now, what you're seeing with her is a little bit extra due to how many doctors I've wrote up, how many agencies I've contacted, like the White House hotline, Christ line for the last 10 years for their level of retribution discriminatory care that I've been receiving. Just medical apartheid, period, like down the line. Like the reason why she acts like this is because her boss continued to assign me barrier class new arrivals who don't want to identify and have no real respect for fundamental black Americans here. Now her boss is the chief of staff, Gappy, who I wrote for the past 10 years, wrote up so many doctors to the point like I feel I have to go this route now due to they run ungoverned. Now her her boss, which is Dr. Gavi, the chief of staff, I talked to him and I asked him, like, why are you keep giving me doctors that's not American? I have 20-something doctors you've given me that's not American. I seen that it seemed like that's by design. I was like, how come if I'm American, I'm American. I was in the military, this is a VA federal hospital, you're in Detroit, why can't I get an American doctor? This fool, which I'll illustrate and take you down this little rabbit hole, this disgustingly little fucking rabbit hole. This fool states to me, well, that would be racist if I give you an American doctor. See, these are the level of games that they play, but I'm going to show you how they're allowed to play these games. So I'm going to, again, peel it back, layer by layer, brick by brick. But I want...
Right. Look, don't look. What it is you're arrogant and mad because I question you on facts you don't know because you're intellectually inadequate right now. Yeah, that's the problem. Right.
I am going to actually terminate the call now.
All right. Oh, thank you. You're terminating a veteran's call because, again, I'm questioning you, and you're arrogant mad because I'm questioning you about what you don't know about my medical history.
If you actually, I am not here to be abused.
Oh, no, now you're being abused. But listen, I'm giving you the same energy you gave me. I'm giving you the same energy you gave me. Yes, I am. I'm giving you the same energy you gave me. Did you not raise your voice at me? Were you not animated with me? Huh? Go ahead.
So I think at this point, Henry, I'm going to leave this conversation.
Right, because you have...
Now I want you to take note after she got what she wanted by ending the call fast, not helping the veteran because she don't want to do any work. And I told you this animosity. But she didn't want to do any work, and you noticed how much of glee she's in. Smiling just so big. Matter of fact, her smile is even broader than her smile in her doctor profile online. Look at the doctor profile online, but after doing dirt to a veteran, look at her smile here. Brighter, broader. See, this is why I call these motherfuckers demons. They on demon time. She's a fucking demon. So that's why I, again, going to this level so you can see what I see.
Nothing to offer. You have nothing to offer but attitude.
With
You're intellectually unprepared for this conversation, ma'am. You're unprepared for this conversation.
To explore the hows and why this system has failed veterans so miserably. We will look into the propaganda that's being pushed by the government, where if you look at the stats and numbers for suicides a day in 2013, 2012, that number was 20 to 22 a day. Now, I did find where it was 44 a day in 2019. Last time I really checked, 2019. So they're skewing the numbers. They're trying to say it's still only 22 a day, but if you look at all the news reports, and I want you to pay personal attention, pay real attention to the propaganda that's being pushed out. If you look at the news reports, they always tell you, oh, it has risen. Oh, it has really risen. It's like, we veterans take the suicide rate 50% more than civilians. Then you even have another guy gets on here and tells you that, one veteran dies every 12 seconds. Something the same number like that. But again, they're never really telling you the exact number. So I'm going to show you as to why they're not telling you the exact number, and why it's by design that the VA, who participates in a medical apartheid with the Veterans Administration, they bag them up, because we have a system here that they run at 100% protection, and the federal government doesn't even run at 100% protection rate. They only have a 97% conviction rate. So you get more, at least the federal government gives you a chance, but that lets you know this system is corrupt. So we will be going in deep dives, chronicling stories, situations to show you the medical apartheid of this system. And again, how it misuses and abuses soldiers. And it's all systematic. So we're not talking about one or two bad characters. We're talking about a systematic way of dealing with veterans. The mistreatment, mismanagement, and the medical apartheid.